Hello everybody, my name is Deepthi Lavu and I'm an academic general practitioner based in the United Kingdom, and I'm the winner of the 2025 WONCA Europe Scholarship. Tell us about yourself and your career. Well, about myself. I got my medical qualification from Deccan College of Medical Sciences in Hyderabad, which is a very happening and rapidly growing city in South India. After graduating, I moved to the UK, where I began my journey in obstetrics and gynecology. And after getting my membership to the Royal College of Obstetricians and Gynecologists, I changed tracks and moved into primary care, which allowed me to follow through patients' journeys. I was always interested in research, and when I was doing my obs and gynae and while training in general practice, I was awarded the Academic Clinical Fellowships, which was supported by the National Institute of Health and Care Research. When I did my research, I used to collaborate at every opportunity I got, and so that led to collaborations with people in Mauritius, Canada, Czech. That's just to name a few. And soon after qualifying, so that was very recently, I was awarded the Welcome NIHR School of Primary Care Research Doctoral Fellowship, which now allows me to continue my academic journey and explore a topic that I'm very interested in, which is health inequalities in primary care, cancer management. I should say also that my curiosity not only led me to research and clinical work, but also to my engagement with the Royal College of General Practitioners, where I am currently a representative of the primary care doctors in training. And just this year, I've been elected to the Royal College of General Practitioners Council, where I will be a nationally elected member for the next 3 years. Why did you apply for the WONCA Scholarship? I always followed WONCA activities, and I thought of it as this prestigious organisation which had great impact. So my current research focuses on health inequalities in primary care management of bowel cancer symptoms. And when I was developing this idea, working on my scoping review, I included studies from the International Cancer Benchmarking Partnerships. And that is when it sparked my interest in actually deepening international connections, basically to better inform, shared health policies. I'm very eager to explore early cancer diagnosis from a global perspective, just for shared learning and key insights which could potentially uncover solutions for equitable improvements in cancer outcomes, I would say. So I think the WONCA Europe Scholarship offers this absolutely invaluable opportunity to form global connections and hopefully transform my visions into achievements. I should say, having grown up in India, I've always admired the World Health Organization's pivotal role in shaping global health. And this scholarship gives me that opportunity to be able to expand my network, which would even work or reach within the World Health Organization. And so, yeah, this is something I'm really looking forward to. Have you been involved with the WONCA or the European Young Family Doctors movement before? And can you tell us more about this? Well, I should say I've always heard of WONCA conferences and events before, but I never managed to go to any of the world conferences or the European conferences. Having said that, I did go to the WONCA GRIN conference in Cardiff, which left this lasting impression on me. I don't think I've been to a conference before, which was fun, extremely supportive, and I could just feel the collaborative atmosphere around, and so you can see why it's left a lasting impression on me. Although I haven't been to many events or conferences, I should say WONCA is not about the events, isn't it? It's the people and the impact they have. And I had contacted just out of the blue, without knowing anyone, some European young family doctor, movement doctors. And I found them extremely helpful. I'm going to name a few here because they've been absolutely brilliant. So there's Dr. Kerry Greenan and Dr. Margarita Gilcondo. There's Ana Luisa Neves, and should I say, for that matter, my colleague from Turkey, who's also won the WONCA 2025 Europe Scholarship, Iqbal Hume Arman. It's been absolutely brilliant speaking to them, sharing ideas with them and getting support from them. And I should say this is what shows the true support of WONCA, which is, uplifting others and encouraging each other to grow within the profession. Describe your plans for the award, your project supervisors and where you'll be based, etc. So my area of interest that I'd like to explore during my award is around improving early cancer diagnosis and reducing cancer health inequalities in primary care, particularly using big data. So soon after my WONCA scholarship was announced, I was awarded the Welcome NIHR School for Primary Care Research Doctoral Fellowship, which allows me now to explore this topic in much more detail in the next 3 years. And so that's what I'll be spending my time doing. And for that, I have academic supervisors who are based in the University of Exeter and Queen Mary University of London. But for the WONCA scholarship, I have a separate project supervisor who's Dr. Victoria Brown and is the incoming chair of the Royal College of General Practitioners Council. As part of my scholarship, I hope to initiate and establish links with various organisations within WONCA and also outside WONCA, and those who collaborate with WONCA, especially I'm thinking of the Young Doctors Movement and groups within the cancer teams. I'm hoping that we can learn from primary care European settings and use that knowledge within the UK and basically explore to see if we can improve care or make changes, possibly for early cancer diagnosis. I'm hoping that these connections, once they'd be established, would be the basis for possibly future collaborations and more impactful work. How do you think the scholarship will help your career? So I believe that this opportunity that the scholarship offers is massive if I achieve my plans for the duration of the award. It will provide me with the connections with the linked organisation. It offers me the opportunity to visit centres and learn at events, and it opens doors that I wouldn't have otherwise even dreamt of knocking on if not for this award. It'll allow me to develop skills which are linked to cross-organisational, international, and just cross-cultural engagement. Learning the language of discussions across nations, empathy and appreciation of what we have within the UK system itself or our own systems, and just give us a wider lens. It will give me the platform, it will give me the network and the learning which will make my work that I get involved in not only just impactful in the UK but possibly across nations. So it's a massive thing for me. Can you tell us about a family medicine doctor who inspires you and why? This is a difficult question for me. I mean, there are so many brilliant doctors that I find inspiring, right from colleagues that I've trained with to those that I've read in books. I mean, there's so much that I could learn from them, and I'm always awed on a daily basis. Having said that, there are two people that sort of stand out for me, and I'm proud to say I'm related to both of them, who are my grandparents and were doctors in India. So one of them was a doctor who refused to go into a slightly larger city, but preferred to work in a small town where he could make a bigger impact. I remember patients sitting and waiting for him on this wooden bench, and he'd call them into a small room where he'd mix medication, because that's how it used to be done with giving drugs in that age. And people absolutely loved him. The other person is another grandfather of mine who worked in a slightly larger setting, and patients would wait for hours to see him. They used to bring their own cots and put them under trees while waiting for him. And I think the one distinct thing I remember most is when there were hundreds of people gathered in a downpour just to say their final goodbyes at his funeral. I mean, that showed to me what he just meant to them. And that's a memory I carried from when I was very little. So you can imagine the impact it's had.